Welcome to Bovine Banter with the Penn State Extension Dairy Team. I'm Ginger Fenton, an educator with the Extension Dairy Team. Throughout this series of the Bovine Banter podcast, we are focusing on transition cows. In this episode, I will be talking with Extension veterinarian Dr. Adrian Barragan. If Dr. Barragan's voice sounds familiar, you may remember him from previous episodes of this podcast. Thank you for being here, Dr. Barragan. Can you please tell us about your role with Penn State Extension and what your research interests are?
Well, thanks, Gigi, for having me as speaker. And yeah, I recall my times with the podcast. I hope I still could serve, but other duties have came along. But I'm happy to see the podcast doing so well. So happy to be here and thank for the invitation. A little bit about my role at Penn State for the ones that don't know me. I am an extension veterinarian, an associate research professor within the veterinarian and biomedical science department. I have been here at Penn State for 7 years now. It's crazy how quick times goes. And my area of expertise is on the transition cow. Transition cow sort of management, focus on preventing disease and improving welfare, and also a secondary sort of area of interest for me is reproductive performance or reproduction and employee management or workforce management. That is strong accent come from being a native Spanish speaker. So as people in this industry know, being bilingual is very, very, very beneficial. So I do a lot of training of Spanish-speaking employees in farms related to disease prevention and best management practices.
Great. Well, we're looking forward to you sharing your expertise with us. Can you tell us what transition cow inflammation is and why it has received so much attention in recent years?
Yeah, well, this is sort of that has been the hot topic for many years, as you say, Ginger. And the easiest way to explain transition cow inflammation is by describing as an inflammatory state related to the parturition process. And what I mean by an inflammatory state, I mean that biomarkers of inflammation are high in the concentration of the cow, but there is not an active infection. There is not active sort of, for instance, when the cow hits her leg or hit any part of the body, it's going to create an inflammatory reaction. So there is not an active lesion that is causing that inflammation. These increase biomarkers of inflammations or increased concentration of these markers of inflammation that we see in the cows are related to all these physiological challenges that happen around calving in that transition cow period, right? Or in this transition period that is known as the 21 days before calving and the 21 days after calving. Now, perhaps that's the easiest way to define this in layman terms. And then why it has been so important is because many the people has been for 20 or 30 years in the industry. They might remember that back in the late 90s, early 2000, we start thinking more about this period and sort of the main challenge that was back then, that was the drop in dry matter intake, right? We start looking more at the cow and how the cow behaves, and we identify the cows drop their intake around that time, and that came along with a higher mobilization of fat tissue, right? Those energy reserves, predisposing the cows to enter in this negative energy balance, which there was a lot of research back then that found associations with this negative energy balance known as ketosis and increasing risk of disease, poor performance, such as low milk production and low fertility. Now, and I say now, this was already like 15 years ago, in the mid 2000s, 2006, 2008, when we first started getting the first apply research on this area. There was another player that was identified. It was this systemic inflammation. And this systemic inflammation has been associated with drop in dry matter intake as a causative effect, actually, that it might be causing the drop in dry matter intake, or one of the causing effect of that dry matter intake. And also it has been associated with the metabolic stress, which that fat tissue mobilization and that negative energy balance. So now this inflammation challenge comes on top as perhaps one of the most critical challenges, physiological challenges, how I like to call them, for that transition cow. And then a lot of research, a lot of efforts are being allocated to how can we modulate this inflammation. And you say that I'm making an emphasis in that word because we want to modulate it. We don't want to inhibit it, right? And without getting into extent, and it's just gonna do a pass so we can have more of a conversation, a monologue here. But the inflammation, that inflammation, it is needed and is normal. The problem is when it gets too high, and that's what I'm talking about. Modulated, we want to bring it down to the normal levels. All right, and I'm gonna pass there.
Okay, well, that's an important language to be aware of. My next question then, how does it affect management strategies for transition cows?
Well, I mean that has been the question of applied research for many years, right? What type of we have our gold standards management practice when we think about transition cow, right? Like low stocking density, having that 85% stocking density in the prepartum pens, right? Going up to 85 to 90 in the postpartum, non-commingling first lactation cows with older cows, feed push-ups, all these best management practice that we have known of for 10 15 years ago. So how those relate to inflammation is an area that we don't know much, right? Most of those practices that we praise as gold standard, our best management practices, they have been put in place because of their association with the original challenges, which was the drop in dry matter intake and the metabolic stress that come with that fat tissue mobilization, right? But now there's a little more research coming out, a little bit from our research, other from Dr. Overton up in Cornell, that is starting to look and say, okay, this is how this management, how these practices affect inflammation. And the short answer to that is that it's not a straight cut. Is some practices align with a proper inflammation? Other practices actually are causing more inflammation. And is such the thing that is not a straight cut, but also it varies based on the group of animals that you're managing. It's different for for those primipars cows or first lactation cows compared to the older cows, right? So it's much more complex that we would like for applied research, right, or for the field situations of field management. But perhaps the positive side is that there is more and more research being done in this area, and I envision that in the next 5 or 10 years, we're going to have a very defined set of best management practices that are beneficial for all the challenges, right? For all those changes to help the cow cope with all those changes, the drop in dry matter intake, the metabolic stress, and the inflammation. Because again, all those are related and they cause each other, right? So we want to create a management program that addresses all of it, not only one or the other.
Great. Well, we will watch for an extension program on this and down the road in several years, hopefully.
Hopefully soon, yes.
So thinking about the vocabulary that you just used, also, what are some of the options for anti-inflammatory interventions, or as you say, to modulate that inflammation? What can we do?
Yeah, that's a good question, and for the people that knows my work, they're listening. They might know that this is the main area that we have done research at my lab, and there are a few options, but it's the same. It's not a straight cut, and it's not that as an extension veterinarian, an extension research or applied researcher, I always try to find like for easy, simplistic approaches that fit the farm logistics, right? And we had come out with a few strategies that actually were beneficial for a group of cows, such as the use of aspirin postpartum in cows with dystocia. We developed a protocol of 2 days, like treating the cow right after calving and 24 hours later. We have found positive effect on cows with dystocia, so milk production, decreasing inflammation in multiple cows, improved fertility, right? And we recently published a work, actually 3 months ago or so, where we treated cows prepartum with aspirin and also with meloxicam, another anti-inflammatory medication that is in the group of the non-steroidal anti-inflammatory drugs. So aspirin and meloxicam are both in the same family. And we found positive effects on certain group of animals. So on over-conditioned cows that were defined as 3.75 or greater, and on primiparous cows, those heifers that will calve and become first lactation cows, right? And one thing that we are starting to dive more into the new research that we're doing now is like to narrow it down more to specific group with specific features and make it more applicable, right? Not only to pick the medication is needed, and also that can be used, because don't get me started with the aspirin whole issue these days with the avian influenza outbreak. But we can touch base if you want to briefly on that, because we can talk for hours. But not only identifying the right medication, but also the right group and the right time, right? And make it simple enough to be utilized in the farm. So that's what we are working these days in the lab, just sort of teasing out those pieces and developing a better protocol for that. But as of now, my main recommendation when it comes to producers or field veterinarians is, well, the first thing, always talk to your veterinarian if you're a producer, right? And you want to implement any of these. And the second of that is just do not do blanket treatments. We're far, far off from that. Blanket treatment maybe as a patching strategy when we're having like much larger issues that will take longer to address. Sure, temporarily only, right? And we have found benefits on that, but we cannot go on saying that all the cows need it, and we know that, right? The cows do well. The management is what sometimes does not do well. But with that being said, we're moving away from any blanket approach that you can imagine. So we're not treating all cows the same, but we're trying to group animals based on specific feature. And the main feature that we have identified as an increaser for or as a risk factor for exacerbated inflammation is cows that have calving disorders. And there will be dystocia, twins, and stillbirth. Okay, those are the first primary one. So when it comes to those, the main recommendation is just to treat these animals with some of the protocols we had developed, of course, with the consultation and guidance of your veterinarians. And then we're looking into other features for cows pre-partum, and we have found positive effect of treatment of over conditions, so those fat cows before calving, 14 days before calving, with either meloxicam or aspirin. And now we're doing a study to train the cows at dry off. But again, we are looking into cows that are overconditioned. We're looking into cows that have high somatic cell counts. We're looking into cows that are being dry off with a lot of milk, right? Those cows that they're not ready, but time-wise you must, right? Because they're getting fat, and although they're producing a lot of milk, that's going to be cycle hard to get out if you don't dry them. So those cows, they must be dry, but that high milk production is definitely going to cause inflammation in an animal, right? Yet we don't do anything on anti-inflammatory treatment on those animals, and that's what we're trying to assess in this study. But yeah, sort of to keep it short, and without going to too many specific of the actual medication, because I don't want to leave any message about what medication to use. The message I want to leave there: talk to your veterinarian, and I will be more than happy to guide your veterinarian or teamwork with your veterinarian to come up with a strategy that is allowed, right? And is applicable as well. But that's sort of like the summary of all of the research we have done and sort of the main knowledge in this area.
Thank you for the important reminder to work with your veterinarian, please, and talk with your veterinarian. I think you could probably talk a lot more about this topic, but I know you also have some other research interests, and there are some other important topics related to transition cows that we don't want to overlook. So you've also mentioned the use of precision technology for early disease detection. Can you tell us more about the technology and the diseases that it's helping to detect?
Yeah. I mean, I mentioned earlier that we are just driving away from the blanket treatment, blanket preventative treatment approach, sort of. And a last comment on that is that type of approach is only still be relevant for disease prevention, such as vaccinations, right? Because vaccination, we know they're effective. We actually created improving the immune system, and those are much needed. And I don't think that we're never going to drive away from that. And I wouldn't recommend that either. It's more on the, maybe sort of those weaker associations, or perhaps, management that are trying to patch bigger problems, right? Like what I was talking about, the aspirin, that it will improve fertility, it will improve milk production, right? And not only we did 3 studies that showed that, but also I have many farmers that have used it back in the day, and they always get back to, hey, this is great, we're having the results expected. And my always recommendation was, you can use it temporarily, but you gotta look at something else. Diet might be off. You might have too many cows. There's something else that is causing that, because the cows are needed, right? But anyhow, so going back to this technology, another thing that the industry is sort of driving away in the transition cow management is about the daily monitoring of these animals, right? 10 years ago, the main recommendation that I did in my extension workshop was to check the cows every day after the morning milking, and check the temperature, check the vaginal discharge, check if they're eating, right? Now we know that about, if we go to the incidence of diseases in the first 60 days in milk, we know that about 30 to 35% of the animals get at least one disease in the first 60 days in milk, right? Which this is telling us is that 70 or 65% of those animals, they don't need to be checked. They're not going to get sick, right? So what we do when we check those animals, we are adding stress, and that's called handling stress. That's stress that might not be super meaningful, but at the long term might add, especially when you do daily for the first 21 days, it might add up and contribute to becoming more susceptible to disease, especially in those first week after calf, right? So with that being said, we're sort of driving away from that full hands-on and very intensive monitoring. And a way to do that with a better peace of mind is by having this activity monitor technology, right? And I always say that I'm not gonna go on and recommend to every producer to invest on this, because the biggest challenge of this technology is that it's a big upfront cost, right? And I don't want to leave the message that everybody has to go and purchase this, because we still can do it without them. We can do selectively check animals that are into certain range of days in milk, to decrease the number of observation of those animals, and they just do a weekly checkups, and then just check animals that come out with low milk production, or we can just walk the feeders when the animals are fed and just look if we see an animal off that's not eating, or if we see the animals with a bad discharge, of course just check that animal and provide proper treatment, right? So that's perhaps one point that I want to make clear. It's just not want to convey the message that everybody go, but the people that has it or has the capability to purchase is definitely beneficial. Is an extra tool. It's not everything, right? But it's an extra tool to have, and is really aligning with this hands-off approach that we are seeing more the industry to be more moving forward to. As far as what type of monitors, there are a number of them. There are ear tags, there are collars, there are boluses that goes in the rumen. The parameters they measure, they're fairly similar. Some of them have a little extra capabilities. For instance, like they can measure the temperature, body temperature, and body temperature changes. And based on that, they can measure water intake, right? Because when the cow drinks water, it sort of cools down the device and measure that, or can measure fever. So there's other things that some of them can measure, but most of them, they can measure rumination and activity. And the neat part of this technology that is not that it utilizes one average and based on that see which cow is off or not. It uses the same cow as their benchmark. And that's exactly what we need, because every cow is a little different, and when you think about average, you still have 95% of the population that is in between that average, either higher or lower, right? So these devices utilize the previous data from that cow to know when that cow is off, and it flags the animal, and it's not really going to tell you what the animal has, right? It's just basically gonna flag it. Some of them, they have the capability to suggest something, and there's some research that has been looking to comparing the actual flag of the device with the diagnostic that the employee or the veterinarian will do. We are not there yet. Let's put it easier like that. In some diseases was a little more sensitive or a little more accurate, but other diseases like metritis was pretty off. So the main recommendation that I do in this area is like, if an animal is flagged, it's worth doing a full physical examination of that animal, right? So if you have this technology, and some of this technology not only is going to use activity and rumination or temperature, but also it's going to use the milk yield, because they are connected, they are synchronized with the milk with the parlor, and they also get that data as well. So if the animal gets flagged, it's definitely worth checking to see what's going on in the animal. And if we cannot find anything, let's do another check the next day. Sometimes these monitors, in some conditions, they have been able to identify changes even up to 5 days before the animal actually shown signs or clinical signs. Let's put it clinical signs of the disease. So that's sort of the way that I'm recommending the use of this technology. And again, let's use it as an extra tool to our toolbox, not as we have been in the business for long enough that we know that there's no such a thing as a magic bullet, right? That just doesn't exist. So everything that comes up is just gonna be an extra tool that we just gotta use it holistically and add it to our program in the best way possible. But we cannot rely on only one tool, right?
I think we covered some of my next question, but I'll ask it again. And if you have other things you'd like to add, please do. And I'm going to combine them. So I wondered what you see as the benefits of using this technology. And then also, are there any downsides to using technology?
Yeah. I think that I covered some of that. I just probably can summarize it as the benefits. I said is definitely is useful to flag abnormal trends on behavior and and activities such as rumination on the animal. So it's effective on that, and it definitely well deserving of checking those animals. And the biggest downside is the upfront cost, right? As far as maintenance, it depends on the company. What I have heard from producers is that it really depends. Some companies are good, and even within the same company, some regions have better reps, and that is usually they're fairly good for my, and this is just experience, right? It's no science based here. Don't quote me, but in what I see in the field, that most the companies that the more common companies that are being used, they have a great customer service program, and they and I haven't heard about any of these devices breaking down. The sort of the lifespan is actually fairly long, and even the companies just replace them when they're out. So it's like upfront investment cost, but after that it's fairly economical to have it.
So the third topic that I wanted to explore today related to transition cows is hypocalcemia. Can you explain this condition, including the signs that a producer should look for in transition cows?
Yeah, hypoglycemia is one of those initial challenges that we knew for many years in the transition cow, and a little bit. So what is the hypocalcemia? It's a low concentration of calcium in blood, and depending the study, the cutoff will change from 8.5 to 8 or 8.1, depending what cutoff you want to do. And this, if I recall properly, is milligrams by deciliter. But regardless of that, is basically low concentration from that. And hypocalcemia can be classified in subclinical and clinical, right? And the first thing that I was mentioning about hypocalcemia, that when it comes to the clinical hypocalcemia, also better known as milk fever, we have done a terrific job in the last 10, 15 years on controlling that, right? So we went from 10, 15% incidence to 2 or 3 now. Some farms, they even have, 1% or 0.5% annually rate. And that is because the industry had developed very effective preventative strategies, such as DICA diets, for instance, or basically selecting and rationing the feed stuff for the diet to have a low concentration of the the cations, right? And have higher anions sort of to create that metabolic acidosis and activate the parathyroid cycle, right? So the practices that have been developed and they are mostly implemented, they're very effective and preventing the clinical version, right? However, when it comes to the subclinical hypocalcemia, we still have about 40, I think the last study found 35 to 40% of the animals that develop this subclinical form. And, this is sort of like that ghost that nobody sees, but is definitely hunting people around, causing economic losses because this subclinical form is associated with the increased risk of disease and poor performance. And one of the main mechanisms that this happens is that calcium is needed for many physiological processes. One, perhaps the most common one that everybody might know is calcium is needed for muscle construction, right? And when we think about parturition, the uterus had to contract. Those abdominal muscles had to contract to get the calf out of there, right? But also that uterus had to contract to get the placenta expelled, right? So with that being said, that is one of the effects. The same with the rumen and when we think about displacement of the abomasum, right? When we have hypocalcemia, it's a big risk factor for displacement of the abomasum. And how it happens, basically that rumen is just either decrease the frequency or doesn't contract at all or enough, and then it just create that ectasis, and then that abomasum just get full of air because the ingesta is not moving along, so the bacteria just ferment that ingesta and produce gas, and then it gets loose up and just get misplaced, or even can get torsion in the same side, in the right side, right? Those is some of the mechanism behind, but the other very, very important mechanism that why hypocalcemia is associated with increased risk of diseases, especially infectious diseases, is that calcium is needed for proper immune system cells function. So those immune cells, they need calcium to properly do all the functions that they have when it comes to killing bacteria or labeling bacteria for other cells to come. And so there's a number of different, without getting too into the terminology, like oxidative burst or phagocytosis, all those functions, they need calcium. And low calcium, they definitely negatively affect those functions. Therefore, the bacteria is not going to get killed, right? Or it's not going to get controlled. So those perhaps is some of the main areas that these diseases affect cow performance and cow health. And the last thing that, without just taking too much more time, but the last thing when it comes to hypocalcemia, I mentioned one classification, which was subclinical and clinical. But now there's more knowledge that is suggesting that hypocalcemia is not as easy as just saying subclinical, clinical, but also there might be a time component on that. Dr. Makar Shes from Cornell, she published a work, it's already 6 or 7 years old, but she's adding more to that later, to that work, where she classified the cows in different type of hypocalcemia based on the occurrence, time of occurrence, and also the length, right? So we talk about this transient hypocalcemia, more of delayed hypocalcemia, or the chronic hypocalcemia, right? And she sort of like made that classification and showing that the transient hypocalcemia is actually is okay. There's nothing to worry about that. The problem is when the hypocalcemia occurs later, so there's nothing at the beginning and then it's delayed, or when it's consistent, when it's prolonged, right? Those are the trouble ones. And she suggested like doing a more, when you're screening for hypocalcemia in the past, we used to say, hey, just take one blood sample 48 hours and that's what we need. Now Shes is suggesting that we need 2 blood samples, one at 2 days or 48 hours and another one at 4 days. And with those 2 samples is when actually we can tell the whole picture of what's going on.
So in addition to sampling twice, do you have other suggestions for strategies that a producer can use to help manage hypocalcemia?
Yeah. I mean, I mentioned about the main strategies that we had that have been successful according to the clinical. Um, in the past we used to do the boluses and all the older cows. So one thing that I forgot to mention about hypocalcemia, the older cows, third lactation and higher, they're more susceptible because basically the short, long story short is that those bones have lower concentration of calcium. They are not as dense on calcium, so therefore there's less calcium that can be pulled from those bones. So in the past, a common recommendation was to train all those cows with some sort of calcium supplementation, and the most common form was boluses. As of now, I don't know if I recommend to do that anymore, right? I think if we do a good management program pre-partum, we shouldn't be needing that even in our older cows. Now, if I have one of those cows, one of those older cows that had something else on it, dystocia, stillbirth, twins, highly overconditioned, definitely I will recommend do that, something like that, but not to all the multi-purpose cows, right? Always look for additional stressors. Age by itself, if well managed, should not be a reason for doing any of these additional preventative strategies.
Thinking in terms of big picture for the whole farm, what suggestions do you have for a producer who wants to improve their overall approach to transition cow management?
Yeah, I mean that's a big question, I'll say, and many of these recommendations they come out with self upfront costs. The people like in the industry as listening, they might agree with me that one of the main issues that we have in the states that we know that we have that are really hard to address is overstocking density, so having too many cows in not enough space, and overconditioned cows, right? Just due to the feed stuff that grows in our location and they're available, and also it's a delicate balance. It's hard for not get overconditioned cows, right? So, if I had to summarize the main challenges on management on the dairy industry in the United States, that would be those two main ones. But with that being said, I mean, the big picture when it comes to management of the cows is going to be consistency. Try to be consistent, and for being consistent you need good people and you need to keep your people, right? And the good people is nothing without proper training. So there are a few things to think there. So we need to not only train the people, but we need to make to foster uh, an optimal work environment to keep our people, the reliable, the knowledgeable, those guys that women and men we want to keep. We do it by fostering an excellent work environment, right? I mean, we can go on with another episode on that because so much to talk, and as you know, Ginger is a big area that I work as well. But that is sort of perhaps the more simplistic approach. But then when it comes to managing those cows, I still recommend most of our gold standard practices. Try to maximize dry matter intake. The best way to do that is try to keep the stocking density the lowest possible. When you think about, and again, I'm an extension veterinarian, which means I have to be applicable, right? And sometimes research is not applicable, right? So I'm trying to get research to the middle ground, when it comes to getting as close as applicable as I can. But research will say that we need to keep 80 to 85% stocking density in our prepartum pens. But I always recommend at least try to keep it in 100. No more than 100, 110, just keep it in that range, 90 if you can, right? There are different ways we can do that. We can even divide pens with gates to move cows more often. There's a delicate balance there because if we move cows too much, that also can add stress and also affect metabolic of the cow and also inflammation. But there are ways to work on that. But that would be one. Feed delivery frequency, we always at least recommend to do twice a day. Fresh feed. Fresh feed is one of the main drivers for the cow to get up and eat, right? So fresh feed delivery is one of, if not the main driver for the cow to stand up and eat. Feed push-ups as well. At least try to Dr. Grant's research from Minority University, they actually came out with the first 2 hours after fresh feed delivery is the most critical ones to do push-ups every half hour, because what, the cow is just eating constantly and they push that feed farther quicker, right? So every half hour in the first 2 hours after feeding, we want to get that feed closer. And then after that, we can do every a couple hours, 2 or 3 hours will be okay. Avoiding commingling first lactation with older cows, which quite often is not possible. And I always say, if you have a low stocking density, commingling is not that bad. The problem is when you have too many cows, and also you have bigger cows and smaller cows. Those smaller cows are gonna get the short stick, right? And then when it comes to inflammation, it really is coming up with providing a comfortable environment. So we want to have good bedding material, enough bedding material, right? Sometimes we have the mattress with sawdust, and sawdust is expensive or it's not available, and we have no sawdust. Those are the things that can increase that inflammation. Sunbedding the same. If we don't have enough volume in those deep sunbedded stalls, we're gonna have the same issue. Keep it that dry, very important, right? Dry bedding material. Heat stress, right? Avoiding heat stress, providing proper heat abatement practices also is critical to decrease inflammation and stress. And the last portion will be just handling. How your people handle those animals will have a huge impact on their comfort, right? If they're aggressively handling them and they're twisting their tails, if they're yelling at them, those animals, they're going to be in a high level of stress. One study that we did that actually was really shocking is that we sampled prepartum cows, 40 cows per farms, 20 heifers and 20 older cows. And we just look an average, what was the inflammation in each farm? And it was shocking to see that some farms have no inflammation. Those cows were like 0. And other ones were picking high. Management-wise, they were basically, when I look at the facilities and the cow, they were basically similar, because, there are farms that we work on daily basis and whatnot. But then, it really came to me that it most likely might be due to daily management, right? Either people managing them, or maybe things that in one visit we cannot see, right? But it was really interesting to see the variation between farms. Although they were the same group of animals at the same time before calving, the inflammation really varied between farm. When it comes to, that we're doing more and more research to see what are those management factors that are actually affecting that. But as of now, if we had to recommend something, is mostly related to how we manage the cows and keeping them comfortable. That's it.
I appreciate that. I think that was a great answer for giving some practical information as far as employee management and training and understanding what can be implemented on the farm. So as we wrap up, do you have any other parting thoughts that you'd like to share with our listeners?
Conclusion I will do here is that there's still so much we don't know. Still so much we are uncovering and trying to understand. But I always say that the simple we can go on this, the better for us and the better for the animals. And I always put example of, I mentioned at the beginning that one of my areas of expertise is repro. And I always put example of the synchronization protocols. When it comes to the synchronization protocols, research have shown that some of them, they are 5% greater, pregnancy per AI or whatever is the outcome. So they're 5% better than others, but they are much more complex and they require, 5 or 6 more shots. And I would say, if you're trying to implement that in an operation that they don't have the right personnel, that they don't have enough personnel, they don't have the right system, for instance, the ability to easily lock animals and stuff like that, stick with the simple. If we do the simple well, we most likely going to have fairly similar results that the goal, right? The best, right? So I think that comes, is a good message to leave out there when it comes to transition cow management. Let's try to keep it simple, and also use the common sense, right? When we think about comfort of the animals, it's fairly straightforward. The animals don't like hot. The animals don't like wet. The animals like to be, they don't like to be yelled. They don't like to be hit, and they don't like to be overcrowded. That's pretty much, and they just like to eat. So we keep that in mind, and we just put our management on that, and and in order to do that, we just need to have, as I said before, the right people, and retain the right people. But also we have to have the structure. And I'm gonna wrap up with that. I'm gonna finish with that concept. The structure, what I mean is that we need to develop our protocols and our program first before we want to train somebody. If we don't have a solid, really structured program about how to manage those cows on a daily basis, that's just not going to happen. It could be in our head, and it could be really good in our head. And I seen, I help a lot of producers building these programs and putting them in paper, because yes, we can have it here and it look great, but if we cannot show it to the people that actually do the work, it's going to be meaningless, right? It's not going to happen. It's going to be, doing half the way instead of everything as we want it. So we want to make sure that we put it in paper, and we put it clear for the people, for the audience that we are applying, right? And with that comes a lot of knowing our personnel, and language is a big one, as you know, and Ginger. But even sometimes we put in Spanish language, but the level of the grammar is too high. We gotta bring it down to the level of education that our people has. So it's really making sure that the message gets through us. So we have to have a structure of the program, but also we have to effectively communicate it to our people. I'm gonna leave it with that.
Well, thank you very much. I completely agree with you that protocols, standard operating procedures, and then training everybody to be consistent is hugely important. Thank you very much for taking the time to talk with us today, Dr. Barragan. Thank you to our listeners. Don't forget to tune in next year as the Bovine Banter team continues to explore topics related to dairy production.
Thank you, Ginger.